Hello viewers, I am Dr. Sourav Choudhury and here's the short discussion on managing the ABCs of diabetes. So what are the ABCs of diabetes? A would be A1C test, what we doctors call the glycosylated hemoglobin test. Now this is a marker, an indicator of your blood sugar control over the last 3 months. Usually your blood sugar control of the last 1 month has a higher bearing on your HbA1c status. Usually, but not always, your doctor would probably want to put your HbA1c levels at around 7%. Please note that this is also highly individualized. This is not a fit for all thing. Your doctor would take the decision regarding where to maintain your HbA1c level based on what other disorders you have, your age, how many hypoglycemic attacks you are having, whether you have a cardiac condition or not, whether you have a kidney condition or not, and so on and so forth. But this is important. An individualized HbA1c target is important. Your B would be blood pressure. Now blood pressure management is also fundamentally important in the management of diabetes. Once again, usually but not always, a 130 by 80 or 140 by 80, depending on what guidelines your doctor is following, is an ideal marker. Once again, this is also highly individualized. This will depend on whether you have a cardiac condition, will depend on whether you have a renal condition, and so on and so forth. Apart from the drug therapy itself, what is also important is the dietary advice that your doctor is prescribing for the management of your blood pressure along with your diabetes. And C, last but not the least, would be your cholesterol. You might be knowing there are many different kinds of cholesterol. If you look at your lipid profile report, you will find different notations like your LDL and your HDL and your VLDL and triglycerides. This LDL is what we call the bad cholesterol. Your HDL is what we call the good cholesterol. So essentially, your doctor would be formulating your treatment in such a way that your LDL level goes down and your HDL level preferably goes up. The value of your target LDL, low density lipoprotein, would once again be highly individualized depending on what other conditions you have, depending on your cardiac status, depending on your renal status, depending on your ability to respond to the drugs that are used to reduce cholesterols, primarily the statins. But once again, individualization of therapy, individualization of treatment targets is of fundamental essence. These are your ABCs in the management of diabetes. Thank you.